Regular spot checks for hand, foot and mouth disease or HFMD will soon begin in primary schools. Minister of State for Health, Dr. Amy Khor says the Education Ministry will carry out the new checks. This follows feedback that HFMD checks should be extended to primary schools.
Including primary schools in spot checks comes shortly after the Health Ministry announced it will also carry out checks at private enrichment centres. Previously, spot checks for hand, foot and mouth disease were only conducted at kindergartens and childcare centres. Latest figures from the Health Ministry show a slight decrease in the number of HFMD cases last week compared to the previous week. But Dr. Khor emphasised that the community needs to be vigilant.
Hand, foot and mouth disease is common in Singapore and can be transmitted in many places, whether it's schools, homes or public places. So we need everyone to play a part in maintaining high standards of personal hygiene. And we also want to encourage the parents, the educators, the caregivers to ensure that their children maintain high standards of personal hygiene. In addition to the fact, I think we also must remember that actually adults can also get infected with hand, foot and mouth disease, and then subsequently they can spread the disease.
Public health officers will be conducting weekly checks on kindergartens, childcare centres and private enrichment centres.
Temperature checks, visual checks, whether they do this properly, visual checks for symptoms of HFMD and other diseases, and also whether they have frequent cleaning of furniture and other places where children frequent.
So far, the Ministry of Health has identified 3 childcare centres and 1 kindergarten with more than 10 HFMD cases and a transmission period of more than 16 days. Childcare centres and kindergartens of more than 16 cases must be closed for 10 days.